Hello, this is a brief video on how to help manage nausea. And while nausea is not a side effect for all, it can be paralyzing for others. And feeling nauseous is absolutely exhausting, and trying to eat food while you're nauseous is quite challenging. So here are some nutritional strategies that we can use to help cope with nausea. First, do your best to stay adequately hydrated. Dehydration significantly increases the feelings of nausea. Sip on water, herbal tea, broth, or other beverages that sound appealing to you. And try to consume most of your fluids away from your meals. Include electrolytes daily. This can be absolutely pivotal. Electrolytes help to assure that your fluids reach the inside of your cells. Aim to eat small, frequent meals. Ironically, you may find your nausea is worst when you have an empty stomach. If you're nauseous upon waking, or when you have an empty stomach, no need to force a meal. Simply aim to consume 2 to 4 bites of food. Then allow 15-20 minutes to pass. You may find that at that time, you're now in a better position to consume a small meal. Additionally, start your day with ginger. Ginger has been shown in multiple studies to help with nausea. Additionally, it acts as a prokinetic, so it helps to push food downwards within the intestinal tract. This is oftentimes helpful for nausea, early satiety, as well as slow gastrointestinal motility or constipation. You may add ginger to various foods and beverages, including soups, smoothies, oatmeal, and more. Ginger tea and/or ginger chews or lozenges are also ginger options. Avoid sweet foods and beverages as well as fatty or greasy foods. These foods are likely to trigger or exacerbate nausea. Additionally, food served at room temperature or cool temperature may be tolerated more easily, as hot foods emit aromas that, when you're not feeling well, may trigger or exacerbate nausea. Other foods that may sound appealing or less averse when nauseous include items like miso soup, a simple broth, peppermint tea, chia pudding, rice congee, coconut water, a liquidy fruit smoothie, oatmeal or some sort of a porridge, yogurt, or fruit. Here are some lifestyle strategies to cope with nausea. 1. Essential oils. Simply smelling lemon balm, peppermint, or lavender essential oils can be relieving. You can sniff the bottle or diffuse into a small room. Acupuncture is another option and has been found to be very effective for some struggling with nausea. It may be worth considering. A third option is CBD. This is one that many cancer patients find helpful for the use of CBD with nausea. Most opt for a tincture to place under the tongue or chewable that they can easily consume. If appropriate for you, CBD may be a consideration. Additionally, antiemetics or anti-nausea medications are another option. You may talk with your medical team about the use of these medications to help cope with nausea. If one medication is not working, perhaps a different one would be effective.